Hello everyone and welcome to the DAIReXNET webinar. My name is Mireille Shaheen. I'm an extension dairy specialist at the University of Idaho and I'll be the moderator today. So today's webinar will address automated calf feeders on U.S. farms. Our presenter is Dr. Marcia Endres from the University of Minnesota. Dr. Endres is a professor in the Department of Animal Science with an extension research appointment. Her research interests include dairy management as well as welfare and behavior. She has studied how various housing and management systems can influence health, welfare, and performance of dairy cattle. In recent years, she has also conducted research and outreach on precision dairy technologies, including individual cow behavior sensors, automated calf feeders, and robotic milking systems. Marcia has published over 200 popular press articles, 65 scientific abstracts, 70 conference proceedings, and 40 peer-reviewed scientific manuscripts. She represents the University of Minnesota at the National NC 1029 Applied Animal Behavior and Welfare Committee and has been a member and chair of the Animal Behavior and Well-Being and the Production Management and Environment Joint Program Committees for the American Dairy Science Association annual meetings. She is a member of the National Dairy Animal Care Review Panel for the Center for Food Integrity and was also a director for the Professional Animal Auditor Certification Organization and served on the Dairy Welfare Guidelines Review Committee. Dr. Endres received her PhD from the University of Minnesota, her master's from Iowa State University, and a veterinary medicine degree from University Federal of Paraná in Brazil. Without any further delay, I'd like to invite Dr. Endres to start her presentation.
Thank you, Dr. Shaheen, for the introduction, and also thank you to DAIReXNET for hosting this webinar today, and all of you who are attending the webinar. Today we'll be focusing on calf housing and precision feeding. To start with, I want to emphasize the fact that still most dairy farms in the U.S. house their pre-weaned calves individually. And there are some reasons we do so, namely individually housing calves results in no calf-to-calf contact. We can use an all-in, all-out approach. So when calves are weaned, they are removed from that hutch. Usually we're going to have good air quality as these facilities are outdoors. We can move hutches to a new ground and therefore reduce the spread of disease. And because calves are individually housed, it's easy to assess their appetite, their attitude, and therefore detect disease easier. Some of these advantages have to do with the operator comfort. So especially I live in Minnesota, and I can think of winters when the temperatures are like minus 40 degrees and it's snowing. So it's for the person who is feeding the calves, there's some disadvantages. Also could be potentially more labor intensive than having animals group housed. And this is something I added that didn't come from Dr. Godden here with my reference. If it's really cold, we could have issues with calf health, or maybe if it's too sunny and we don't have shade. So weather issues also as relates to calves. We've seen a recent trend in the upper Midwest of housing calves in groups. And some of the advantages we can think about of doing so include having more space per calf, so they can now run and play and express some natural behaviors that they could not express in a smaller hutch system. They can also socially interact with each other. So you can see here in this picture, for example, they're playing and that at an earlier age rather than waiting until they get weaned. Depending on the type of system that we use, it's easier to feed larger amounts of milk and also feed milk more frequently. And we can change labor, not necessarily have less labor, but different type of labor, have more flexible labor, and do different chores than we would do if you're feeding calves in a hutch system. So that comes one option that we can use if we're feeding calves in groups, is the automated calf feeder. And as Mireille mentioned earlier in introduction, we've been doing some research at U of M on precision technologies, including the automated calf feeder. So the research I'll be talking to you today is focused on the more sophisticated calf feeders, of which there are basically 3 manufacturers that sell systems in the U.S. The Forster Technique, and those feeders are labeled as the Aleli, the Laval, or GEA Farm Technologies. We also have a system called Urban Feeder, and then the Home and Lau. All of these 3 types of feeders, the more sophisticated computerized feeders, are manufactured in Germany. So they're German developed in Europe. And the advantage of these systems is that they provide us a lot of information about each calf, and we're going to talk a little more about this. So there'll be it can feed either milk replacer or whole milk, or combinations of the 2. This picture here shows the inside of the feeder, and if the powder gets mixed with warm water, and this amount of milk that is prescribed to each individual calf, that's why we call this a precision feeding option. This is delivered to the calf using these hoses or tubes. And each calf has an RFID that identifies, we know who is coming to the feeder, and then the milk is delivered accordingly to the information that was entered in the software. So that software provides for us the information on how much the calf is drinking every day, how many times per day they visit the feeder, and how many of those visits are rewarded, which means those visits where the calf was entitled to have a meal, and how many of those are unrewarded, that there was not time for the calf to drink, so he doesn't get or she doesn't get anything. And also tells the drinking speed, so how fast that animal is drinking. So all that information becomes important because we can download that information, we can archive it, and we can learn more about each animal, and it can be helpful in detecting disease. Like I said, the software allows for flexibility. We can deliver as much milk as we can program it for in terms of how much per meal and how much per day. And in terms of how these systems are managed and set up, it could be, there's just, I think, a little bit more learning on that area, but it does offer flexibility. So it has been a great technology used in Europe for many years. It's just a little more recent in the U.S., but especially in our area, I see a lot of growth and move into that direction. So there are challenges, of course. We talked about earlier of individually housing calves. It's probably better to reduce disease transmission and to observe them. So now we put them together in groups, and it's like taking our kids to daycare. They just bring home some more disease, and they're exposed to more microbes. And in the case of calves, it becomes more difficult to individually observe them and therefore prevent or detect disease. Most of these feeders, they allow you to have 1 or 2 feeding stations per group. So basically only one calf can feed at a time, or maybe, like I said, some of the farms had 2, but that's as many that can feed at a time. So we could see some competition for feed. That becomes a bit challenging at times. And then there's the cost of this equipment. It's not as inexpensive as having buckets and bottles. It's more expensive equipment. It's sophisticated. It's giving us a lot of information. It has flexibility. So they cost around $20,000 per feeder. And you can feed, according to the manufacturer and the dealers, up to 60 calves with 2 feeding stations and 1 feeder. However, as you're going to see throughout my presentation, I think research indicates that we probably don't want to go that not that high of a number per group. The equipment setup, like I said, with all this flexibility, sometimes becomes a little bit challenge for the producers to understand how to use or better utilize the system. And then equipment cleanliness. There is a cleaning place for the dispenser, and not all systems have a cleaning option for the hoses or the tubes and the nipples. Some do. So it becomes very important to keep the entire system clean. And these are things that maybe before the producer had the system in place, there might be something that not everyone thinks about. It's more the attitude, maybe you put a feeder and now we don't have to do a lot of cleaning. But we're talking about calves, and cleaning is really, really important. So we're going to hear more about that later. So most of the research on automated calf feeders has been done in Europe. Like I said earlier, these systems have been available in Europe for much longer. And there are a lot of differences in how we manage farms in the U.S. compared to Europe. So we saw a need to investigate housing and management practices on U.S. farms that are using these feeders, with the ultimate goal of our project to develop best management practices to optimize calf welfare and performance when using automated calf feeders. So the first goal of the project is actually describe what's happening already on these farms that are using feeders, and collecting various observations related to housing, to management, individual calf measurements, things that can help us better understand the system. So we had a questionnaire, a very extensive questionnaire, and I'm not going to spend the time today telling about all the different things that we asked, and I'm not going to be summarizing necessarily that today for the sake of time, but I'm going to be focused on one of the questions that we asked, and we want to understand, why did you decide to buy an automated calf feeder? And these are in priority order. So when we asked the producers their reasons, the one thing that came to the top is that they want to spend less time on menial tasks. They want to be able to do other things with the calves by not having to clean the bottles or the pails and the hutches and so on and so forth. And they also thought that by having a feeder and being able to feed more milk, they would see an improved growth rate, and they would have larger calves. And research done at different universities like Cornell, for example, has shown that calves that are fed more milk early in life or accelerated feeding can have better productivity later in life when they become adult cows. So that improved growth rate is of interest to producers. They also decided to invest on this more sophisticated computerized feeder because they would get more information on calf feeding and then be able to also use that information as indicators of health issues, potentially. Other reasons mentioned were that they could do more natural diet changes, so we can see, basically increase the amount of milk up to a peak milk amount, and then slowly can reduce the amount of milk before weaning. So do a more natural diet change, and at the same time be closer to natural feeding, where you can feed more meals per day and more milk. They thought they would have an improved labor condition, and that has to do with the fact that now they have a barn. The calves are inside, and you can see, for example, this particular dairy here built a barn specifically for the calf feeders. The calf feeders are housed here. You can see the feeding station, and then you have different groups of calves. And now the person who works with calves no longer has to be outside feeding them in calf hutches. So that labor condition for the person that's working with the calf was important. Was actually mentioned by some of the folks that are doing this, especially when it's family labor, that she would say, if we didn't build this barn, I would not feed calves anymore. So that was the reason they want to do so. The perception they would have reduction in labor cost, thinking that potentially they would spend less hours working with the calves, and that was one reason they invested on this system. I don't know if necessarily there is a reduction in labor cost, but there is a change in labor, more flexible labor, so that's still a positive. The fact that now calves can socially interact with each other and doing this at very early ages. That was something that was important for producers, and also express their natural behaviors, play behaviors, running, socializing. And that was interesting enough, and this is a much smaller number of producers that mentioned this, but there were some producers that mentioned they expected to see a reduced disease incidence. Most veterinarians, most other folks and producers themselves, in reality, would think the other way around, because we have them now in a group, and have them in a group, like I said earlier, can spread disease more easily. But there were a few producers that thought by being able to feed more milk, we might actually see a reduction in disease prevalence. But those are the comments that producers had. So I want to share with you today just some of the housing and management practices that we learned producers were using on these farms that were visited every couple months for a year and a half. We had close to 40 farms. They were located primarily in Minnesota and Wisconsin. I think we had a couple of them in Iowa, but mostly Minnesota and Wisconsin. So think about the climate, think about how we manage cows in the Midwest. And my research personnel visit these farms every couple months to get information from the calves and also about the farm. So just to start with, what kind of barn were they built or they're using? 60% of them actually retrofitted some older facility that they had, maybe a tie stall barn or a pig barn. We had the one farm that used the chicken barn. And about 40% of them built a new a meal barn just for putting the feeders, like the picture I showed you earlier, just a couple minutes ago. All of these barns had, or most of them, I should say, had positive pressure tubes that bring some fresh air to the calf level. And for more information on this, you guys can look at articles published by Dr. Ken Nordland at the University of Wisconsin Madison Vet School, Dr. Kevin Yanni, who is a co-investigator in our project here at the U of M, engineer, ag engineer, also has done quite a bit of work with ventilation. And these tubes bring the fresh air at the calf level, and they were used on both natural ventilated barns and also mechanically ventilated barns. I would say about close to 50% of the barns were more mechanically ventilated, either a tunnel or the picture that I showed you earlier, that's a mechanically ventilated barn that's more enclosed, and air comes in through fans along with these positive pressure tubes for supplemental ventilation. We also recorded, and this is from the questionnaire, not from the information that we got from the feeders, the software. This is what the producer targets are for the starting amount of milk, and which is in this line, the yellow line here is the summary. It's about 5 liters per day is what they start the calves when they put them in the feeder. And then the peak amount is how much the calves will get at maximum, that was maximum allowed per day, and that was 8 liters. We see some variation here. Some farms are feeding quite a bit more. Research done in Canada has shown that when calves are fed free choice, they'll drink about 12 liters per day. So some of these farms were feeding more at those levels. And then we also asked the producers what age they brought the calves into the group to use the calf feeder. And the average was 6 days of age, approximately, with quite a bit of variation. We had 25% of our farms putting the calves in the feeder right away at day 0, day 1. And that takes more training, takes more management, if you will. Usually takes a couple of feedings, they said, for the calves to learn. Most of them will learn after a couple of feedings that you manually, basically bring the calf to the feeding station to show the calf how to get to the nipple and get the milk. And some farms were waiting a lot longer. So during that time period, the calves are housed individually in a barn, individual pens, or in hutches. And some of the producers mentioned that they would normally wait until the calf had a very good strong sucking reflex, or they use bottles to train them before they put them in the feeder. And when they felt the calf was strong enough, they would move into the feeder. But overall, that was the age that calves got in the group. We also, at each visit, and again, we visit every couple months for about a year and a half, we noted what was the stocking density in each one of the pens. So this graph here shows us what was the average number of calves per pen or per group, and that was about 18. Like I said earlier in the presentation, the manufacturers recommend up to 30 calves, and we did have a few farms having a lot of animals in the group here, but for the most part, they were 20 or below. And we also measured how many animals we had, how much space each calf had in the group, so the area per calf. And this is here the metric system. It's about 4.6 square meters, which corresponds to 50 square feet per calf. So on average, the animals had good space to move around and play and run, etc. But we did have quite a bit of variability, with some farms having much more tight area for them to move around. So that was quite a bit of a distribution here. And of course, it varied a little bit from visit to visit within each farm. But of course, within each farm was more consistent than across farms. And when we visited, we always focused our attention on two main groups. If the farm was small, so what we call the youngest group, and the group that was closer to being weaned, we call that the older pen. And farms that were larger, we had an intermediate group that we also assessed and measured. So when we're at the farm, my research personnel also scored each individual calf on those pens that I just described for health. We used a modified scoring system developed by Dr. Sheila McGurk at the University of Wisconsin-Madison. We modified that system for use in a group setting. So we scored animals for attitude, ears, eyes, and nose. And then we set of fecal scores early on in the project. As we were developing our protocol, we realized it would be difficult to do so because they're not individually housed. We came up with a cleanliness score, a 0, 1, and 2, as evidence of diarrhea. So basically, we scored the rear end of the calf, and we looked how clean it was. And again, it's not a perfect system. It not necessarily means the calves are sick. It could also be some nutritional scours going on, but that was a way that we could record what was going on with those calves. And then we also scored them for body condition. Any calf that had scored different than 0, which was the normal score, was restrained, and we took their rectal temperatures. We had over 10,000 calves that were scored by a single observer. That was my research associate, Amber, who was trained to score animals using the system. We also asked producers to record treatments and also mortality. I'm not going to be showing that today. We're still in the process of evaluating or analyzing those data. Mortality, however, I'm going to just mention to you the mortality average on these systems was about 4%, which is actually slightly even less than the average mortality according to the NAM surveys in the country at about 6%. It did vary, however, from 0.3. There's a farm that basically didn't lose any calves at all throughout the entire year and a half that we worked with them, to a farm they had an average of 17%. So a bit of a variability there for sure, but most of them were on that range of 3 to 5%. We also collected feeding behavior information from the software, and we're in the process of evaluating that information and see how that correlates with the health scores and the treatment records and mortality. So just to give an idea of what we're finding, this chart here summarizes the top and bottom farms for health scores, abnormal health scores. In yellow or gold, I should say, we have the best farms, and they were able to have below 15% of animals showing any negative or abnormal scores. I'll focus on these 4 first ones here, versus the worst or the bottom 10 farms are having more close to 25% of the animals that had some indication of being sick. And we look at cleanliness scores, they are up to close to 60% of the animals, having some dirty calves. This is just to show you what was the actual percentages of scores 0, 1, and 2 for cleanliness, for example. 60% of them were actually fine, clean, but there were about 40% of animals that there's some indication of having scours. We are doing some analysis of risk factors that are associated with the abnormal health scores, and these are the factors that have shown significance in our model. The number of calves per group, so if you had the greater the number, the more likely to have abnormal health scores. Also, the number of feed stations per pen. There were a few farms that had, instead of having just one feed station, they had 2, but they doubled or they increased the number of animals in that group. So basically, these might be factors that are basically there's some we have to remove one of these 2 because they might be interacting with each other. So this is, again, preliminary analysis at this point. Also, the area per calf was a factor that was associated with abnormal health scores. So if you had less space per calf, we're more likely to find higher scores. So that space per animal becomes important. The time that took to reach the peak milk allowance, it was a factor that affects health. So the faster we could reach that peak, or the faster we could get to a point that we allow animals to drink more milk, we had less problems with disease. So it comes back to the importance of providing calves with enough milk when they're in these type of systems and keeping their nutrition, basically their plain nutrition high. We know calves need to have good amounts of milk to develop well, and all these farms did have starter available from very early on. As the calves get into that group, they were started available, free choice. So it's not like farms that had providing more milk faster had different amounts of starters. So again, the calves have access to both, but when they had more milk, they were healthier. Another thing we measured was the air speed or the air velocity in the entire pen, and especially focused in some areas like the resting area and the feeder area. And we found that if we had too much speed, we found an increase in scores. In the resting area was primarily the nasal scores, which are indicators of respiratory problems. And at the feeder area was more the combined score. We found if it was too much wind, so to speak, or too much draft in that area, we saw some increase in health scores. We're still investigating this a little bit further. I think it deserves more investigation yet. Like I said, these are preliminary results. But again, it's important to have very good ventilation in these barns, but we don't want to have drafts. And another factor that came as a significant risk factor was the standard plate count, the count of bacteria in the tube or the whole samples that we collect. That's the sample the calf is drinking. When they're greater than 100,000 cells per mil, we saw more abnormal scores. And just to show you here quickly what variability we found in the samples that we got from the feeder tube. The best farms, very low counts, again, below the 100,000 mark for the standard plate count here. And for the lower, the farms that had the highest counts, we see huge numbers here in the millions. These are the coliform units per mil. It's amazing that you can have the average per farm of over 20 million. And that's the drink that's what the calf is drinking. So this is something that deserves more work and deserves teaching the producers the importance of clean equipment, clean milk. This is really key in any type of system, especially when you have them in groups with automated calf feeders. This is something from Dr. Sandra Godden, who is a co-investigator in our project, dairy calf health expert at U of M. Some of the practices that are important when you have calves in groups and using automated calf feeders, they work for every type of system, but especially when you have them in groups. Excellent colostrum management, excellent ventilation but no drafts, clean, dry, and abundant bedding, especially in winter times. And we have to have that ventilation, but then we need the bedding so they can nest into the bedding and stay comfortable. Minimum space per calf is important. Free choice water and high quality starter. very important for their rumen development. Careful and frequent observation of calves to detect the disease early. We can rely on some of the information that comes from the feeder, the computer software, like drinking speed, the number of unrewarded visits. They appear to be two things that are very important. But again, nothing replaces the human observing the animals and detecting the ones that might be sick. Using smaller groups is probably better because that reduces the likelihood of disease prevalence. Narrow range of ages is best. Larger dairies can do that easier than smaller ones. But again, having a younger group and an older group is probably important. And not restricting milk intake as much as possible. Having a larger meal, maybe 2 liters per meal, and 8 liters, 8 to 10 per day. So if calves have a larger meal, they'll be less likely to cross-suck each other, and they'll be more satisfied, they'll be resting, and that's very important. I want to remind you or let you know that we have a Precision Dairy Conference coming up where we're going to be having some producer showcases with automated calf feeders and other precision technologies. And there's a website here, precisiondairyfarming.com 2015. I want to thank Matt Jorgensen, my grad student, Amber Adams-Brogar, who is now a faculty member at Washington State University, for helping with data collection, the cooperative farms, our co-investigators, our undergrad students that enter data, and of course USDA NIFA for funding. Without them, we couldn't do this project. And I want to thank you for your attention, for taking the time to listen to this webinar today here, or if you're listening to it later. So thank you for listening. And with that, I'll move on to Dr. Shaheen for her closing remarks and open up for questions, I guess.
Yes, please, everyone, if you have any questions, please type it in the chat box. Meanwhile, Marcia, I was interested at if you've looked at the actually satisfaction level with the producers. Are they happy with the system? What's your impression there? So.
Right. For the most part, we had one producer that quit in the middle of our project. So for that particular farm, we only had, I believe, 4 or 5 visits. And then she actually was a producer who was raising calves for other people. And I believe that maybe there was some issues with the passive immune transfer, that as the calves came from the farms they were coming from, potentially a more commingling of calves. We don't know because it was a very nice facility. But for the most part, other producers are pretty satisfied. The ones that had very high levels of disease prevalence, not so much. But again, I think we're trying to learn how to better utilize these systems and the importance of cleaning the equipment, having good quality, low count milk. I think if they can do some of those things, they'll be more satisfied with the system. But for the most part, they were actually pretty happy with it.
So did they see in general an increase like in respiratory disease or scours or?
No, not necessarily. We're still in the process of tabulating all the treatment records. We feel that they tend to treat calves a little more often because they want to prevent major problems from happening. So it feels to us that they might be treating a little more often, which makes it a little bit harder to evaluate if they're having more disease, of just they're paying more attention and treating more frequently. And we had a pretty bad winter, the winter 13-14. That was a very bad winter for us here, and we did see more problems that winter. So actually, I forgot to put that on my list of risk factor for abnormal scores. We had the higher scores during that winter compared to all the other seasons that we had the project. So when the calves are exposed to colder temperatures, then you're going to see more respiratory problems, and then they might be a little less satisfied with it. They might be complaining more about the system.
Okay.
So good question.
Yeah, and just one more question. How often should the system be calibrated? Or how often do they calibrate it?
The best farms are calibrating it basically once a week. They make sure the system is working. They clean, they change nipples every day, or disinfect them. They take them off, put new ones. They clean the tubes quite often, or replace them, or the hoses. The best farms do a much better job of keeping the system, just in top form, if you will, and that makes a huge difference, I think, on the outcome.
Marcia, did you see a dairy size effect? I know you talked about group size effect, but how about how large the dairies were, or did you look at that?
I don't think that was picked up in the model as significant. We had, for example, one large dairy that has groups of 20. So as large dairy, they have groups of 20, so a little above the average there, but definitely not huge groups. But because they have a more of all in, all out option, because they're large, so the calves are very close in age, they actually appear to have more success using the feeders, but we didn't necessarily saw an effect of size because some of the smaller dairies just kind of do a better job of cleaning, a better job of paying attention to the calves. So I think it's a little bit size independent. It has more to do with the operator and who is working with the animals and who is really hands-on at the facility.
Well, I don't see any other questions, so I'd like to thank Dr. Endres for taking time out of her busy schedule to be with us today. Thank you very much.
Thank you, Mireille, for hosting. Appreciate it.